Okay, well I can maybe tell you a little bit about novel psychoactive substances in Scotland. Some of the things that I was speaking about at the City Health Conference were about trends in Scotland, and some of the work done over festival season with the drugs charity Crew 2000. It was quite interesting doing some of the survey work because lots of drugs were coming up that had been relatively unheard of before. So there was things like 2C drugs, so drugs like 2CI and 2CB, which have had for years on the survey, and you maybe got like 1-2% of people even having heard of them, never mind having tried them. And that jumped up to about 20% of people had tried them, so that was quite an interesting one for me. And also trend-wise, probably around Scotland, the biggest trend is around synthetic cannabinoids. They seem to be the most popular, and for lots of different reasons. Some people talk about them not being detected. So, for instance, if I look at people that come along to my training now, there's not that many drug workers come along to the training, whereas it's lots of people from housing projects and from other services. So that's sometimes where users of new psychoactive substances are being seen. So it's not necessarily in traditional mainstream drug services. I ask that question a lot, why are people maybe not coming forward to services for support? And some of the answers that I typically get are that maybe people associate mainstream services with traditional drugs, and actually even cannabis users may not want to access your kind of traditional treatment services. So for me, certainly in Scotland, there's a bit of a gap of service provision. And also maybe just engaging people in the traditional services. Because if you look at what's happening in other locations, like rural locations, it's just not possible to have specialist services in all these areas. But maybe what we could look at doing is having dedicated workers in projects that maybe do a lot more outreach, because there's a different way we need to look at engaging people and bringing them in, and certainly some of the findings from things like the Club Drug Clinic and indeed work done by Crew 2000 in Edinburgh has shown that if you have a specialist service and if you look at different ways to engage with people such as outreach, people will start coming to you. So people need to feel that there's that connection and that services are relevant to them as well. So that would be one issue. Stimulant legal highs are also pretty common as well. Even the terminology is quite interesting because we often talk about novel psychoactive substances, but a lot of the people that I would support or people that use drugs don't tend to call them that. So even though that they know that they're not all legal, that's still a very common term. So we maybe haven't quite got the terminology right either. But certainly with the stimulant versions, people find them quite appealing as well. If we look at street purity of cocaine, for example, in Scotland, it can easily be in the single figures percentage, so sometimes between 1 and 5%. So that's a real driver for use and why people would maybe experiment with these substances. They're also a lot cheaper for people to buy, really accessible for people, so there's lots of drivers for use for these kind of substances, and it maybe feels like we don't necessarily take the picture perhaps as seriously as we maybe should. I think because there isn't massive numbers going into drug services, people maybe think people aren't experiencing the same problems, and I would say in my experience that's probably unlikely. If we look at the scale of use, there's going to be a percentage of people that are experiencing problems, but equally some people can and do use safely. So it's not about forcing those people into treatment, but it's about identifying the people who will use problematically. One issue that comes up at Scottish Drugs Forum as well as some of the awareness raising we've been doing around new psychoactive substances is it's not just a young people, a club drug user, that sort of thing. I think that very traditionally gets linked. We're seeing that a lot of people who are already in services are just adding these substances to the mix. And of course there are those like hidden populations of concern that are maybe already not engaging with services that are starting to use these kind of substances because they're easily accessible, so that would be another factor.